Being a physician is primarily about understanding diseases, making treatment decisions, and communicating with patients. The biggest challenges for physicians in general are gathering and understanding information. One of the ways that doctors gather information is through the physical exam. We can do a full physical exam, which is a head-to-toe examination of every organ system, or a focused physical exam, which just specifically examines the main organ system related to the patient's concerns. For me, I have limited mobility, and that includes some limited mobility in my fingers and my hands. That can be a challenge in terms of holding the equipment appropriately, but also positioning myself close enough to a patient, especially if the patient is in a large bed with a bed rail, also in a wheelchair. That can make it difficult for me to get the proximity to the patient that I need for appropriate visualization.
Molly and I have been working on this about a year now, a lot of brainstorming at the beginning of how to solve things. And so we decided to develop a simple handheld, low-cost imaging device for seeing, magnifying, and recording images and videos. The device was developed to look at a patient's skin, ears, eyes, nose, throat, and mouth. The device is designed to have a physical separation between the physician and their patient without reducing care quality.
So we applied for a grant from the Rehabilitation Engineering Research Center, and we applied for a grant called the Technology Increasing Knowledge, Technology Optimizing Choice Grant. It's part of the Small Grants Project. The system that we've designed is a lightweight camera that displays images on some sort of mobile device, either a tablet or a phone, and basically I can position the camera in the patient's ear, but the display is on either a phone or tablet, and so my eye doesn't have to be next to the patient's ear to do the visualization. One of the main things about this project that interests me is the ability to allow medicine to be more inclusive, especially as we understand that having a diverse workforce makes us better able to care for a diverse population of patients, and incorporating physicians with disabilities will allow us to continue to increase the diversity in the medical provider base and provide better care for patients with disabilities and other types of patients that represent our diverse patient population.